that's a large study that has used population registry data from all of the Nordic countries. We have merged more than 30 registries from 5 countries. So we have more than 4 million children in our database. And from these data, we have looked at children exposed to anti-seizure medication, defined as the mother having filled prescription for anti-seizure medications during the first during pregnancy, from the last menstrual period until birth. And then we have followed the children for a median of 8 years, so until the child is 8 years in average, to look at whether the child got any diagnosis of neurodevelopmental disorders, and that is autism spectrum disorders or intellectual disability. And in short, what we found was that children that were exposed to Topiramate or Valproate in monotherapy had around 2 to 4 times increased hazard ratio of having a neurodevelopmental disorders, adjusted for a wide range of potential confounding risk factors. We also found that in children that you were exposed to more than one drug in duotherapy, we looked at different types of duotherapy combinations, and we were able to study the 5 most common duotherapy combinations, which is important because some women are not getting seizure-free using only one drug, especially now that Valproate cannot really be used. Then a lot of women has to use 2 other drugs, but we don't really know if that is safe because no one had the large enough data sets to look at specific combinations before. So what we found was that the most popular combination, Levetiracetam, together with the Lamotrigine, was not associated with any neurodevelopmental disorders, whilst the other most common combinations, such as Lamotrigine and Valproate and Levetiracetam and Carbamazepine, and Lamotrigine and Topiramate were associated with increased risk of neurodevelopmental disorders in the same range as for Valproate. So these combinations concerning neurodevelopmental disorders does not seem to be a safe alternative to Valproate, whilst the Levetiracetam and Lamotrigine combination were not associated with any risks, which was good. So we also, in collaboration with our others, have looked at congenital malformations, and we found the same result for that combination, that it wasn't associated with an increased risk of congenital malformations. So I think that's a combination that should be researched more for safety and efficacy as a possible alternative to women that need more than one drug in pregnancy. I want to thank all the collaborators and co-authors that have contributed to the SCAN-AED study and the other data on folic acid and drug safety, both from Norway, Sweden, Denmark, Finland, and Iceland.